We know that this thing is going to triple by New Year's and certainly through the holidays.
Doctors are getting ready for the winter.
If we are not well behaved and we don't listen to public health experts, then we will have to, in this building, like we did in the spring, move to a higher tier where we have more and more patients. We have to surge. We have to open up other critical care areas like we did in the spring.
New York City Health and Hospitals Jacoby has stocked up on equipment and is incorporating new treatment data to catch patients earlier before they get sicker.
We know that things like steroids are effective in certain populations. There's a lot of uncertainty in the spring.
Worried about winter, this union nurse. She's had COVID and is on the front lines at Jacoby. To her, these numbers aren't surprising.
I think a lot of it is COVID fatigue. I get that. I have been, believe me, healthcare workers are also really exhausted. We want to get together with our families too.
Working in the ER, she says she's treating more patients, many telling her they were following guidelines. The state has called this living room spread. There are less options to socialize, so people join together in homes, potentially spreading the virus. This nurse is concerned.
People were coming from all over the country to help us out, and now it's December. We're 10 months into this, and we're seeing spikes all over the country. And that is a concern that the resources that we were able to use last time around won't be available to us.
Other hospitals also gearing up for the winter. St. Barnabas sharing with us this training video as experts learn about demystifier and CPAP helmet treatments as an intubation option. More people are getting tested too, lining up at facilities all across the borough.
And people in the South Bronx, they do want to get tested. Check out this line outside the City MD. This line is long, and people out here, they've been waiting for a long time and in the snow. And for a while too. How long have you guys been out here? An hour? And you're all the way back here?
Long lines to protect people they love.
What's it been like for you out here waiting to get tested?
It's cold.
It's cold. You want to get tested? Why are you getting tested today?
I'm about to go to see my daughter. Her birthday is tomorrow.
City and state officials pushing for people to get tested, especially important in the Bronx. The state health department designating parts of the borough yellow zones because of increased positivity rates, telling us in those areas we are working with New York City to increase testing and expand contact tracing while enforcing restrictions on local activities that can increase spread. We have been anticipating an increase in cases in the colder months and recently announced a winter plan for the pandemic. All this as a vaccine is on its way. But experts we spoke to telling us they are concerned there won't be enough vaccines available right away for all New Yorkers.
It's a partnership of all of us as a community coming together to get through this together.
Eric Stelzer, News 12.